and welcome to another episode of Coffee Talk with Encore. This is the place where we discuss a variety of industry topics, all of which are related to therapy clinicians in a variety of settings. Now, today we are super excited to learn about Encore Rehabilitation's Respiratory Therapy Division and how much good respiratory therapy can do for the quality of life of our patients. Today we have Noelle Cleveland joining us for our Coffee Talk discussion. And Noelle is Encore's Director of Care Coordination, and she oversees Encore's respiratory therapy line of business. So thank you, Noelle, for being with us today. We are so glad that you're here.
Thank you for having me. I'm super excited to be here and to discuss the topic of respiratory therapy with you all.
Noelle, thank you so much again for joining us today. There is a recent statistic that came out that says that 70% of hospitalizations of people with advanced dementia are due to pneumonia. Now, as we know, in our line of work, we work with those with dementia, day in and day out all the time. How do facilities have the power to kind of decrease that statistic by having a respiratory therapist on site?
So one of the important things that respiratory therapists being on site, they are able to provide the therapeutic interventions right there on site without having to send the residents out, whether that be to the ER or to prevent hospitalizations. They are able to provide that care right there on site through some of our programming, through some of their interventions, through providing some of the medications that are needed to help prevent those exits to the hospital.
That's so exciting for our residents because, we know that it's important to the facilities to keep the residents in the facility, but it's so important to the residents to stay in the facility and not, especially with that advanced dementia, not take that trip out to the hospital. It's so shocking to their system to leave the building and then have to come back. And I think another benefit for the facility is that reimbursement under PDPM. And I know talking with facilities right now, they're billing. Some of them are getting to bill a little bit of that respiratory therapy. They've recognized how to bill for those nebulizers, but we know that that respiratory therapist has so many more tools in their toolbox, and they can work with those patients in so many different ways to get them healthier and bill for that respiratory therapy on a regular basis.
That's a really good point because, everything that we can do to capture every bit of skilled intervention that's being provided to the clinicians and really include that in the MDS assessment certainly will make a difference for the patients. It'll make a difference for the facility. So all really good points for sure. I do want to ask, Noelle, is there anything else that, maybe there's some other offerings that Encore's respiratory therapists can provide within the care communities?
Yep, absolutely. So in addition to the therapeutic interventions that we can provide to the residents, the respiratory therapist on site can also provide the education to both the patients and the families to really help with that disease management. And not only can they provide the education to the patients and the families, they can also provide education to the staff. We do a lot of staff education, especially on the side of providing trach care. As facilities are looking to bring in those more clinically complex residents. So we are able to provide nursing checkoffs, general education and competency trainings. We're also able to provide consulting services as well, just as hey, what do you think about this resident? Do you think we're able to provide for their care as an extra set of eyes from that more clinically complex side? Additionally, we're able to help manage equipment from a respiratory standpoint. We're also able to help with the emergency management with having that expertise on site.
It's so exciting for the facilities that we can help with those quality measures, keeping the patients in the facility, both before and during their med-A stay, if they are having that med-A stay, keeping them there. And then if they're going to transition home, that ability to go home and not have that readmission with that respiratory therapist, really working with them on those warning signs, that education, managing their symptoms so much better. And I've also seen that sometimes we have a quality measure that is a little bit unexpected that's improved by respiratory therapy, and that's those antipsychotics and anti-anxiety medications. It's so frustrating and scary for a patient if they can't breathe. And so helping them to breathe and manage that symptom can really lower those antipsychotics and anti-anxiety meds in your facility.
And these are all really good points too, when we're talking to, the case managers from the hospitals, where we're able to show data and show how having a respiratory therapist on site, is beneficial to the residents. It is beneficial to the building. Noelle, if someone would like to hear more about Encore's respiratory therapy program, what is the best way to get that information?
Yes, absolutely. I can be contacted at Noelle, Noell.Cleveland@encore-rehab.com.
All right. Thank you so much, Noelle, for sharing all of your contact information and lots of great information today on the topic of respiratory therapy. Certainly, today's conversation has been extremely informative. And as we have been able to share today during today's conversation is that there are a lot of benefits to having respiratory therapy programs within care communities. Thank you to Noelle for joining us today to share some great information about Encore's respiratory therapy offerings. And thank you to everyone for listening in. We look forward to having you tune in again for our next episode of Coffee Talk with Encore.